Hi, Michelle Glass here. Welcome back to another installment in our Lecture 6, Chapter 6 series. And our topic for this presentation is the anatomy of long bones. Now, we talked in the previous video that there are 6 different types or shapes of bones, with the long bone being specifically long and slender, a shaft with 2 distinct ends. And we said that essentially these are the bones of the upper and lower appendages, with the exception of the carpals and the carpals and tarsal bones, which are both short bones. When we are talking about the shaft of the long bone, which is how it was described for you in lab, we now need to use this new term, which is diathesis. So diathesis is talking about, the long part there of the long bone. And then both of those ends are referred to as epiphyses. That's the plural form of the word, or epiphysis. And of course, you have a proximal epiphysis and a distal epiphysis. And then in the connecting space in between the diaphysis and the epiphysis, you have this middle area called the metaphysis. So you would have 2 of these. So if we're going end to end, it's going to go epiphysis, metaphysis, diaphysis, metaphysis, epiphysis. When you're looking at that epiphysis, you will see that on the very outside of that bone, you have compact bone. So that's what we're looking at here. And then when you break away that compact bone, you're going to see that the epiphysis is full of spongy bone. Spongy bone can also be referred to as trabecular bone. So here's a nice zoomed in photo of that. When we're looking at the shaft, we have a hole there. That hole is called the medullary cavity or the marrow cavity. Okay, so now we can go from the outside to the inside of the long bone. So on the outside, we have compact bone, and then underneath that, we have the spongy or trabecular bone, and then running down the center of that shaft, you have that medullary cavity. So that's the innermost layer. Now, inside the medullary cavity or the marrow cavity, you're going to have your bone marrow, and there's 2 types. There's red bone marrow and yellow bone marrow, and I've already referenced these in an earlier presentation. Red bone marrow is where your blood cells are being produced, and your yellow bone marrow is going to be important in storing fat. Now, we actually have a tissue on the outside that's not present here on this dead piece of bone that I have in my hand. There's an outer layer of tissue called the periosteum. The periosteum is this outermost connective tissue layer. It's going to isolate your bone. It's providing a route for your blood vessels and nerves, and it's also going to be important in assisting in bone growth and bone repair. Okay, so this is a nice diagram that I got from our textbook, and it's showing us that outermost layer of that periosteum. So peri prefix, of course, means around, and osteum is referring to bone, so literally it translates to around the bone. Notice that there's both a fibrous and a cellular layer, so that will be important as we progress through. This periosteal layer is continuous with your joint capsules. It's forming your ligaments, which attach bone to bone, or it's important in the structure of the tendon, which is muscle to bone. So in that case, the tendon is formed from the skeletal muscle, and then it gets woven into the periosteum. Your periosteum is full of collagen fibers, and really anytime you see that, you should think, okay, that's super strong tissue. If we look at the tissue that's lining that medullary cavity, so the very innermost tissue, and actually is wrapping around all the different struts and extensions of that spongy bone, we have what's called the endosteum. So end as in innermost, and osteum, of course, is bone. Now this is another important layer. It's our very innermost layer. It's wrapping around every single cavity, foramen, very innermost layer, and we'll be talking about the different cells that make up the endosteum as we progress through. So again, if we're now going from outermost to innermost, we need to include the periosteum, and then we can see our compact bone, and then inside to that we can see our trabecular bone, and then of course we have our medullary cavity, which is then lined with the endosteum. I've already mentioned that the endosteum is lining all of the trabeculae, so all of those extensions of the trabecular or spongy bone. It's lining all canals, all foramen. It's going to be lining the central canal that we see as part of our osteon structure that we'll be talking about. And we'll see that the endosteum is important in bone growth and bone repair, and also what is referred to as remodeling. So we'll be talking about that in the future. Okay, stay tuned.